conversations between a healthcare provider and a patient should be more personal. The relationship needs to be more intimate.
Oftentimes I'm not used to being listened to, but you listen to me.
If for some reason I lost all my memory,
what's the first thing you tell me about us?
I would remind you where we first met. And that will probably be on the ward.
I think I'd probably tell you what a great relationship we have as doctor and patient. And I guess that the love and mutual respect that's there.
I so remember that, Rebecca. I was a young consultant at the time. We got to talk at the time as well, and got to know each other, and kind of thought, yes, there is that kind of relationship that's building now.
At what point in your HIV journey did you feel the most vulnerable, and what did it teach you about caring for yourself?
My mother's born and raised in Montgomery, Alabama. So the stigma of HIV is always connected with your lifestyle in a whole.
One of the things I'm most keen about is talking about self-stigma and that HIV does not make you any less deserving of a beautiful, rich life. But
it took me almost 3 years to finally call and tell her.
I had a miscarriage earlier this year, and
she told me to never call her ever again. That's what you deserve.
I remember waking up at like 3 a.m. And all I could hear was all of the things that have ever been said, that women living with HIV don't deserve to have kids. Oh.
And I'm always going to be, I always want to have a proud parent.
Yeah.
And I believe I'm never going to be able to give that to her.
Stigma is the thing that I think has surprised me at every corner.
But you know what? It is what has given me the strength to help others. If I can't make her proud, I'm going to make everyone else proud.
I was in hospital and I'd met somebody the week before I'd gone in. And so I rang him, explained I was in hospital. He said, "Oh, you're still free on Monday night then, can I not come in and visit you?" And it blew my mind. And he came in and for the month that I was in hospital, he came and he saw me every day.
That's incredible.
And struck up a romantic relationship with me in hospital. I mean, without meaning to sound dramatic, literally dying of AIDS. And what it taught me was that there is always the possibility of love. That however bad things look like, there's always hope and there's always love.
What do you feel is often left unsaid between a patient
and their healthcare provider? And why do you think that is?
Oh, I think the truth is left out.
There's something about the vulnerability around functioning that is just a difficult one to broach.
We're not having conversations about sexual health openly oftentimes.
I wasn't taught how to talk about sex until I was like 25, 26.
There's a lot of stigma still in our community.
It's the fact that people still buy into that power dynamic of, a doctor.
The doctor is looked at as the authority in the space.
can't say those things. I can't be, I can't be somebody that isn't perfect for my doctor.
And now I'm feeling the shame of what I've done, and I don't want to be open and honest with them because what if they judge me? When in fact, they're not there to do that. They're there to make sure that you're healthy and up to everything that you need to be up to.
There's so many other elements with a doctor that I would want to have instead of just being this kind of like sitting in front of a judge, fearful and trying to impress and straighten your tie up.
It's like, no, the whole point to be here is to talk about the challenges, the difficulties, and that is exactly why they're here, to be able to help, to want to make a difference when people are having difficulties.
I think sometimes the truth is left out because we fear judgment.
It's important to me to know that they don't judge.
Yeah.
And they treat me as an individual instead of this statistic.
People don't feel the most comfortable to be vulnerable about what they're doing or like what's going on with their health.
I completely understand that anxiety, and I would say just be totally honest with your team.
Because a lot of times people will leave little tidbits out, and it could be really important, and you're not necessarily giving them the right information because you don't have the
full disclosure.
Yeah.
It's really important to be as open and honest, as candid with the person who's trying his best to make your life and your care so that you can get the best quality of care, as they say.
Have audacity. Like, this is your health. Advocate for yourself. And if something doesn't feel right or if something isn't working for you, don't suffer in silence. Like, make sure you bring that up and have that conversation with your provider.
And I think that's something we need to think of as patients, because a lot of the time we think, I'm just here for the clinical stuff. But sometimes if you explain, I'm living in a occupation place, and I would prefer something that's a bit more discreet. It helps you think, and we can plan them together.
I think what I hear most often is the lack of appreciation from patients, that they feel that their doctors don't appreciate what a psychological burden it has on them. And therefore, whether that's about their wish to change treatment because of side effects or because of facilitating an easier option or a longer term option, that they don't feel heard or understood, and that how important it is to them, they're not able to speak that truth, or they're not given the space to do it.
So it's very much a two-way conversation. I think we've got to learn a lot of that. We've got to just be open and honest.
You make an assumption that when people are coming to see you as a doctor, that they know that I'm for them, like, because that's why I'm there. But as you say, you don't know. You've got to be told and made to be assured about that.
Yeah. Shared decision-making, honest conversations, and going on a journey together. I think it's,
The relationship needs to be more intimate and less, just words on a report, and numbers on a lab document. Just more creative.
Yeah,
absolutely.
That's awesome.
What do you wish people understood more about HIV and why?
They don't know that if you have a good relationship with your support system and your clinician and all that it really kind of starts to kind of fall on the rank of priority in your life.
Yeah.
And that you get to live and thrive and be in. They don't know that the meds allow it to be so.
If everybody on this planet understood that because I'm on effective medication, that my virus is reduced to undetectable levels, which means that it cannot be passed on, that undetectable equals untransmittable, that for me, I think, would be the biggest potential to change people's fears and judgments.
What do you appreciate most about our conversation today, and why?
Hearing about, although I see your medical records, it's just in black and white in a medical record. And I don't think we've ever, or I've never heard you talk about it in terms of what it was like to live through it and how vulnerable you felt.
I was an arrogant young man coming to HIV medicine, and that kind of opened my eyes into kind of looking at people as people rather than disease.
Okay.
And that, I think, really changed me.
Humanizing a medical history is invaluable.
I love hearing your thoughts and your experience on something that we share in common, but it's a very different experience.
What surprised me the most was around how similar our stories are.
I haven't had the greatest relationship with doctors and clinicians, you know, so just know walking away today that you made change and that you have changed a little bit of how I feel towards doctors.
Yeah, I appreciate that and giving me that insight because that will allow me to be hear the doctors and nurses in our facility.
Give them a little grace.
Yeah, definitely. Definitely a little grace because I'll be like, geez. Like.
I think over time, what being a physician has taught me is that fundamental empathy and the privilege of learning empathy and compassion, or channeling your own empathy and compassion from a place of vulnerability, of the vulnerability of others.
If this were to be our last conversation, we're going to end on a positive note. If this would be our last conversation,
what's one thing you never want me to forget?
How important those appointments, phone calls, interactions are for people. Those can shape them and stay with them forever.
The trajectory of those first few encounters you have with someone that's newly diagnosed and how that can completely change their course for years to come.
Don't ever forget that this is that person's life and whole journey, and you get to nurture and shape that. And that's a really big responsibility.
Without you, I'd have probably been on another journey, if that makes sense. Because I think my whole HIV journey has been influenced by all of the people in it.
Yeah, it's responsibility, but it's a privilege as well.
Yeah.
Yeah, it really is.
It's a privilege that I've got to do this work.
Yes.
I thank my patients for elevating me to my best possible self.
Yeah.
Not there yet, but I'm a little bit closer than I was 15 years ago because of them.
How much you matter.
we can't do something like that.
No, you need to know if you didn't realize. Personally, professionally, in HIV, in London, in the UK, in the world.
Your input in my life has been enormous.
You really make a difference on a daily basis.
If I had to write a biography, you'd certainly be in it. So yeah, you'd go away thinking you've made a change in my life.
Patients don't really have a reason to tell you that.
Right.
So those words mean the world to me. It keeps me going, quite frankly. So thank you, brother. I really appreciate it more than you can ever know.
It's nice to be understood and not question who I am in a world where I'm often misunderstood. So to have that, it's a blessing, honestly. I'm very grateful for you, I must say.
We'll keep on working one person at a time. You work with your kids, I work with my kids,
Yeah.
everybody else work with their kids. And
Yeah.
we dilute this hate with just people who just see each other's humanity first, above all else.
That's awesome.
Yep.
Thank you so much.
Virgil, it's been a pleasure, man.
Yes. Thank you.
Yep.
It's a privilege and an honor.
Straight back at you. Thank you. Goodness me. Can we never do that again?